My name is Jason Scott. I am an RN. I currently work for a major dialysis firm in the United States. I am also a board member for Northwest Kidney Kids. This is a nonprofit organization that is geared towards kids and their parents that have some sort of chronic kidney disease. So today we're going to be presenting an educator's guide for kids with kidney failure. So starting off, we're going to talk about several different things. We're going to talk about some of the common complaints that the kids that I've worked with have had. We're going to review some really basic anatomy and physiology. We're going to take a look at the effects of kidney failure on the body. We're going to look at some of the statistics surrounding kids with kidney disease. There's not a lot of statistics that are available, but what is out there, we're going to kind of review briefly. And then we're going to take a look at all of the most significant needs that these kids with kidney failure have. So these common complaints from these kids. So I have been their camp nurse since 2015. We see these kids twice a year now, both at summer camp and for a winter retreat. And these kids, when we check in with them, they have a lot of the same issues that they keep talking about year over year. And some of these issues relate to, are they going to be able to graduate? And if they do graduate, what is that going to look like in the future? Are they going to be able to go to college, hold jobs, all of that kind of stuff? Friends and relationships. So, you know, are they able to find love? Are they able to have these romantic relationships? Are they able to make connections with their peers, like their classmates? Moving on towards their own health independence. So once these kids turn 18, a lot of these services that they're receiving and support stops. And so a lot of them have this real concern about, you know, I'm sure most of us were excited to turn 18. 18 for some of these kids can be pretty scary. And their own health needs at school. Are they able to get their health needs met, you know, while they're going to school? And so one of the things that I did in working with Northwest Kidney Kids was I put together this survey. It targeted kids between the ages of 13 and 24 that have some form of kidney disease. It did require parental approval if they were under 18. And it targeted the Healthy People 2020 leading health indicators. And so this is something that was put out by the Office of Disease Prevention and Health Promotion. That's part of Health and Human Services. And it specifically talks about access to healthcare services, injury and violence, mental health, oral health, nutrition, physical activity and obesity, their reproductive and sexual health, social impacts on health, and drug use. And so from this survey, as of October 7th, 2020, all of the kids that responded to this survey went to public school. Only a quarter of these kids rated their mental health as either a 4 or 5 on a 5-point scale. 25% of them said that they see the school nurse as often as they need. Of those that responded, 75% cited all 3 of these items as one of their major concerns: is college, their transplant, whether it's their current or their next transplant, and relationships, whether it was finding love, maintaining a romantic relationship, what that relationship might look like, and just fitting in with their peers. 75% say that their parents manage the majority of their healthcare needs, but only 25% wanted to take care of their healthcare needs, but said that their parents wouldn't let them. Most of them did say that they were confident in their own health knowledge. The majority of these kids, 75%, say that their teachers do not treat them the same as everyone else. Only a quarter of them felt accepted by their peers. Half said that they feel at least somewhat unsafe at school. 0% stated that they were confident that their teachers knew about their health needs. And 75% say that their teachers didn't give them enough time to take care of their health needs. And so whether these are true or not, right, their perception is their reality. So if it's untrue, what are some of the things that can be causing them to profess these internalizations? Sometimes statements or mannerisms can be interpreted in unintended ways. And so any mannerisms that could be exhibited, that some of those can come across as making these kids interpret it in this manner. So based on the answers to these questions, this is why this presentation was created, hopefully it gives a fresh perspective on what it means to have kidney disease, and empowers you with the knowledge of what it means to understand why their medical profiles are the way they are and why those profiles are so important. And so moving on to just some really surface level kidney anatomy and physiology reviews. They're about fist-sized organs located near the back bottom of the rib cage on either side of the spine. They receive about a quarter of all of the blood that's pumped from the heart. They maintain blood levels by filtering out toxins, electrolytes such as potassium, sodium, calcium. They also may regulate the blood's pH level, and they also excrete excess water. Urine, the major component of urine is water. So regulating that water is super important. They also excrete several hormones. These hormones can regulate blood pressure. They tell the bone marrow to make more red blood cells. They promote calcium absorption in the gut, and they also help regulate bone health. And so if we do have abnormal renal function, they may stop or slow down that hormone excretion, which means their blood pressure may go up. Their red blood cell production may drop. They may have poor calcium absorption in their gut, and their bone health might decline. I have had young adults in their early 20s who have had worse bone health than these little 90-year-old ladies with advanced osteoporosis. So it's very significant. It slows or stops removal from filtering out the blood. So toxins will start to build up. These electrolytes, this potassium, sodium, calcium and stuff, their kidneys don't get rid of them, so those build up in their blood. Their pH starts to get a little bit acidic, and then they start retaining water. And so when we talk about kidney failure, it's a very specific part of kidney disease. So there's 5 stages of kidney disease. The 5th stage is what we call kidney failure, renal failure, or end-stage renal disease, ESRD. And that's when there's less than 5% of normal kidney function remaining, and their kidneys are no longer able to support life. At this point, they require some sort of renal replacement therapy, whether it is dialysis or a transplant. A transplant is not a cure, it is a therapy. And so when we look at these lacks of filtration, when we're talking about the toxins, kids can get really confused if these toxins start to build up in their blood. They can have longer blood clotting times because their platelets don't quite work nearly as well. They may have trouble sleeping. These toxins, as they build up, put their body in this constant state of stress. They may have poor temperature regulation, so their body temperature may be lower than normal. If they get an infection, the fever may not present nearly as as strongly as if they had healthy kidneys. And they may have a lack of appetite. They've got all these toxins in their body, and their body is saying, whoa, slow your roll. You know, we don't need more toxins. You don't need to be eating more. Electrolytes. So if you get some of these electrolytes building up in their body, they may start to have things like muscle cramps. They may itch, and oh man, the itching is terrible. Nothing seems to fix it. They may develop an irregular heartbeat. They may get a rash. They may start to have water retention. And so with that water, if it gets to their lungs, they might get short of breath. Their legs might swell. Their blood pressure might go up. If their pH starts to get out of balance, they may start to have some mild confusion. They may get headaches. They may be nauseous. Most often they will be tired and weak. And again, they may have a lack of an appetite. And you can see a lot of these things kind of cross over and compound each other, right? So the toxins and the pH both have confusion. The pH makes them tired, but the toxins make it difficult for them to sleep, and which kind of turns into this really vicious cycle. Toxins and pH both have this lack of appetite. And so you can see a lot of these kind of work, I want to say work with each other, but kind of work against the patient, because, you know, they just have this really bad compounding effect. And so when we're talking specifically about kids with kidney failure, there are nearly 10,000 minors that are living with kidney failure in the US today. And those kids are either on dialysis or have a transplant. A kid with kidney failure is 30 times more likely to die than a kid with otherwise healthy kidneys. Their life expectancy is 38 years old if they are treated primarily with dialysis. It goes up to 63 years old if they are transplanted as their primary therapy. And that's a huge difference, right? And so this really kind of emphasizes how important that the maintaining these kids' transplants are. And these kids are often supported by this whole pediatric nephrology team. There's usually multiple different specialties involved, and it often stops as soon as they turn 18. So there's that dreaded 18 again. And so these kids have many, many different needs that as educators you may see throughout the day. And we're going to talk about each one of these individually. So fluid intake. Kids may have water goals. They may have to drink anywhere between 2 and 4 liters of preferably water, whether they have pre-kidney failure or if they have a transplant. They may have fluid restrictions if they're on dialysis, depending on how they react to the dialysis. They may even have fluid requirements. But the main goal is to prevent dehydration or overhydration. They may also be taking medications that increase your urination. And so if we think about these 2 to 4 liters, how many of us can drink 2 to 4 liters of water in a day, right, without struggling? But drinking that amount and having these medications that increase their urination, they need free access to the restroom. I mean, it can be something as frequently as needing to go twice within a period of 40 minutes, depending on when they take their medication. They may have bladder or bowel irregularities. Bowel irregularities are very common after transplant. The most common bowel complaints would be abdominal pain and diarrhea. And some of these medications can exacerbate these irregularities. So whether they're on steroids, that can increase how fast their gut is moving. Some of these antibiotics can just wipe out the normal flora in their gut. And certain anti-rejection medications can actually cause diarrhea. So again, kind of like the fluid, they may need free access to the restroom. Most of these kids will be on very strict medication regimens. They may be taking anti-rejection medications, especially if they have a transplant. These are very strictly timed. They need to be taken within this 30-minute window. The most common times are about 8 and 9 a.m. And missing these can lead to the loss of their transplanted kidney. Oftentimes, a lot of these medications require them to take them with meals, and a lot of meals require them to take medications. And so, for the latter, this is especially important if they're eating smaller and more frequent meals, which we'll kind of talk about here later. Then this helps reduce the stomach upset caused by some of those meds. So they may need access to food, during class. And some of these medications replace certain minerals that their body may be losing, such as magnesium or calcium. A lot of these kids may have social, emotional, or mental underdevelopment. They may have behavioral or learning problems. As we kind of talked about earlier, that toxin buildup can cause brain fog. Some of these medications and these toxins building up can cause this trouble concentrating. They may have delayed language or motor skills development, and they may face some really significant rejection by their peers. A lot of them are subject to bullying, and as we all know, just because somebody is different, that may be a cause for bullying. A lot of this stems because others, peers, teachers don't understand their health conditions or their health needs. And so you take all of this into consideration, and these kids are at really high risk for developing these mental health disorders, such as depression. It may lead them to illicit drug abuse, or even suicidal ideation or behavior. They may have these really significant body image issues. They may have growth irregularities. They may be shorter than average. They may have physical disabilities because of these growth irregularities. A lot of these kids have had multiple surgeries, and so they may have many different scars, whether it's from their transplant. They may still have tubes that are still in their bodies. Maybe they've had grafts to cover some of this up. Maybe they still have a dialysis access. Some of these dialysis accesses can look pretty gnarly. And some of these anti-rejection medications will also cause weight gain. And so you take all of these together from these body image issues and these social and emotional development issues, right? And it's no wonder that a lot of these kids really suffer from worse negative self-image and relationship problems. So they're already have these growing pains. So, we all remember what it was like growing up through our teens and, dealing with all of that stuff. They have all of this stuff to deal with too. So if they're on the transplant list, this gets to be really significant because remember, the life expectancy for kids that are primarily treated with dialysis is 38. So we want to get them off of dialysis and get a transplant. But in order to get a transplant, they have to have so many appointments that they go to just to determine if they're even eligible, right? They may have multiple appointments during workup, additional things that they need to go do, follow-up appointments. And even once they're on the list, they may need constant follow-up just to make sure that there have been no changes since they were approved to go on the list. They can get a call at any time, so they may need access to their phone. because once they start making those calls, sometimes these transplant centers, there are very few chances to respond before they start moving on to the next on the list. Some of these kidneys, once they're taken out, can only last for so long on ice before they've got to get into somebody. And so that's why it's so important that they're able to respond to that call as soon as possible. And oftentimes they need to have a go bag ready. So, maybe it's a change of clothes, some toiletries or whatnot to get them through that first night or two while they're in the hospital. Excessive tiredness, and we already kind of touched on this a little bit earlier. This is not narcolepsy, right? But kids can be just straight up fall asleep right in the middle of being able of doing something, and this can be caused by a lot of different reasons. Dialysis is a very, very stressful treatment on the body, and it wears a lot of people out. We talked about high levels of toxins causing people to be very tired. There's some medications, maybe those medications are keeping them up at night so they can't sleep, which makes them tired. Some medications make them tired. If they're having trouble sleeping, again, we kind of talked about that chronic level of stress with that toxin buildup within the body. A lot of these kids are germophobes or should be germophobes. Infections are the #1 killer of transplanted kids. The transplanted kids are on these immunosuppressants to prevent their bodies from rejecting these kidneys. So it tamps down their immune system. High levels of toxins. So your kids that are pre-kidney failure or maybe on dialysis, just the high level of toxins can actually cause their immune system to not function nearly as well. There's lots of different kinds of vaccines that they just cannot have just because of their kidney failure, their immune status. They're technically all considered immunocompromised. So any open wound that you or I may worry about, they have to worry about. We get a cracked fingernail or a hangnail that's split, that pulls off or something like that, right? If we get an infected finger, most of the time we don't worry about it. They need to worry about those kinds of things. A lot of these kids are at really high risk for urinary tract infections. And some of these different antibiotics that are used to treat these bacterial infections can actually really interfere with their anti-rejection medications. So that's why it's so important that they maintain their hygiene. Some of these kids do need to eat more frequent, smaller meals. When they do this, it's much easier to manage some of these mineral deficits. So if certain forms of dialysis can actually cause mineral deficits, so maybe they do need to have more sodium or more potassium in their diet, a lot of times it's easier to manage that if they're having maybe 5 meals spread out throughout the day instead of 3. Maybe they have other conditions. Maybe their stomach just doesn't work nearly as fast. So if they have these huge meals, it's just going to sit there for a really long time. If they're on peritoneal dialysis, they may have fluid in their abdominal cavity. And so some of these kids may not be able to eat as much. So they may feel fuller earlier. And so again, those more frequent, smaller meals may help combat that. And it's much easier to increase their fiber intake because constipation can be a real problem for a lot of these kids. And then multiple other medical conditions. So it really depends on the cause of kidney failure. That same issue can affect many other different systems. And so when we're talking from birth to 4 years, the most common diagnosis for kidney failure is birth defects. And depending on the kind of birth defect, that can affect multiple different other systems. Hereditary diseases, something like lupus, is most common for 5 to 14-year-olds, and lupus has multiple different systemic effects. And then there's other systemic diseases for kids that are 15 to 19. And so, as we kind of talked about, there's a lot of things that we really need to keep in mind that we may see over the course of the day for these kids that you may experience. So kind of understanding why some of these things are the way they are might kind of help you understand why these things are so important.